Hey there, everybody. Good morning. Today is Friday, December 8th of 2017, and I'm here with my week 41 Post Duodenal Switch update. Hi, I'm Lisa, and we'll do stats. So I am 48 years old, 5'2", and I started this journey on January 2nd, 2017, weighing in at 344.6, which was my highest recorded weight. And then I had surgery on February 24th of 2017, and on that date, my surgery weight was 308.8. Last week I came to you at 173 even, and this week I'm at 173 even. So that's a 0, and that's okay. That's fine. I have not been the best weight loss patient the last couple weeks. So I'm totally okay with that. And honestly, the other part of the equation is really I've never had a real slowdown, so it doesn't shock me or concern me. I think everything's going to be fine. So what's been going on? So this week has been an okay week. I will tell you guys that I made the Goodies mix chocolate chip cookies, and they're just kind of They're okay. They're way better like the next day than they are when you first bake them. And it has the smell like I'm sorry, I have a super itchy eyeball today. It has the smell of chocolate chip cookies. I added walnuts to them as well. But I just I'm not loving them. So I'm disappointed. I really, really was hopeful for those, but the stats on them are fantastic. The recipe said that they made 12 cookies. I ended up making 13 out of it. I was going to make them with some ice cream and make ice cream cookie sandwiches with them, but the cookies are kind of thick. I think maybe next time I might give them a little pat down to begin with, but for something sweet, it's an option. Not a favorite option, but it's an option. I did try a couple more of those Power Crunch bars this past week. I tried I think it was a salted caramel, and I really liked that. That was really good. And the stats, again, were very decent. So, really very good in carb total and sugars. So, yeah, I like the Power Crunch bars. What else can I tell you? Okay, so as you can hear, I've had a cold for a couple weeks. So my surgery is less than 2 weeks away, which is really freaking me out. I think it's 11 days now. Yeah, the 19th, 11 days. So I had to do blood work again after I had just done it a few weeks back for my my 9-month surgiversary, 9-month doctor's appointment. And, blood work was still good. Actually, my white and red blood cell count had come up, so that's a positive thing. But my potassium, which runs low, it runs the same. I think I've mentioned it a million times when we talk about vitamins and whatnot, that I run exactly 0.1 lower than the lowest range on the scale, and it never changes. But they called me yesterday and they're like, yeah, the anesthesiologist is not okay with that. I guess anesthesia and pain medications do affect your heart and your heart rate, and I have a way low heart rate to begin with. In fact, the PA that was doing my pre-surgical workup and was like, your heart rate's really low, and I'm like, yeah, I know, it just is. My heart just is not having to work as hard as it did when I was 345 pounds. I mean, so that's a great thing, really, in the grand scheme of things, but the anesthesiologist is not good with it, so they've put me on a potassium pill every day that I take up until surgery. So we'll see if it changes anything. To be honest with you, I don't hold out much hope for it, but I'm doing what they tell me to do. Oh, okay. So I gotta tell you guys this, and I've been meaning to tell you, gosh, for at least the last 4 or 5 weeks, but I keep forgetting. So, yes, I need to recolor my hair. I did color my hair a couple months ago, and it was fine, but I need to recolor. But what I wanted to tell you guys is that at right about the 9-month mark, I stopped losing my hair. Hallelujah, right? So, I mean, yes, everybody has some hair loss, but it's normal hair loss to lose a few strands here and there. But yeah, I finally stopped losing my hair. I was so excited about that. Now, I'm not really getting any regrowth to speak of, but that's okay. Just as long as I don't lose anymore, I'm thrilled. So that was really like a big deal, and I kept forgetting to tell everybody because hair loss is so common during this, after you have weight loss surgery. It's just such a common thing. It does stop. It is scary. Oh my God, so scary how much hair I've lost. But yeah, so I'm really excited about that. And then, I don't know if you guys know this, I live in the Midwest, so we experience cold and snow all the time, and I am not a fan. However, I had so much fun hearing about my friends in Texas, hasta cielo y más, and my VSG confessional, Aaron and Kristen. Just Kristen seeing your kids, in the snow, the pictures and video that you sent me was so cute. And Aaron, you were so excited about the snow. So it was really fun to see that because I just don't get a big whoop out of the snow anymore because it's so common and I really don't enjoy it to begin with. But I can remember when I lived in Arizona and one time friends went up to Flagstaff and literally drove down a truckload of snow in the back of their truck, and we all played with it. But anyway, so that's really, that was fun. Other than that, what are my plans for the next couple weeks? One, I'd like to get over this cold. Two, just really trying to get ready for this surgery. It's really stressful, especially being at the holidays. So just trying to get everything done ahead of time is, God, it's just so difficult at times, just to be overly prepared. Yeah, so that's what's going on. And then I was talking with my husband, and I'm a little nervous about my food options in the hospital after surgery. And so I told him I'm planning on bringing a bunch of protein shakes, and I might just kind of liquid diet it for a couple days while I'm in the hospital. I usually have problems after surgery with constipation, and I really don't want to have to deal with that on top of, everything else I'll be dealing with. So I'm thinking I might do liquid diet for a few days while I'm in the hospital just to see how my stomach does. But yeah, so that's what's going on with me, guys. Like I said, I have not been the best bariatric patient. I haven't been horrible. I definitely know that I can attribute a lot of my extra choices in food to stress. I guess it's a good thing that I recognize that, but I'm having trouble controlling that. So I'm working on it. It's every day is a new day, and I'm trying not to let any choices I made the day before, good or bad, influence my current day. It's really kind of the only way I can go about it. But yeah. So, and then, you know what I really want for Christmas? My husband doesn't even know this. I think I want a smoker. I know, isn't that weird? But I do. I really want a smoker. I know I'm not getting one, guys, okay? But, yeah, I thought gosh, wouldn't it be great to have one of those and be able to, like, smoke a brisket? And, oh my God, it just, like, even thinking about it sounds so good. But who knows? Maybe I'll get that for a birthday present next year. Hint, hint, wink, wink. Somebody tell my husband. Okay, guys. Well, I'm going to cut this off. This is a long video for me, and I really haven't, had a whole lot to say, but just a quick update. Let you know that I'm here. Things are still going along. Oh, I have a bunch of new subscribers. I keep forgetting. I love it. I love that you guys are finding me, and I'm so excited about that. And please, like I always say, don't hesitate to ask me questions, because I'll answer them. I'll tell you the truth. If I don't know the answer, I'll tell you that too. But I can only tell you what my experience has been to here. And yeah, well, welcome and good luck to everybody who's, contemplating surgery and doing all their pre-op appointments. I will talk to you guys soon. Have a great week. Bye.